Welcome to Discover a New Future, a show that's geared to empower women to be the best versions of themselves. I'm your host, Faith Saunders, and today I have a special guest, Dr. Omar Bey.
Oh,
Welcome,
yes.
Dr. Obey.
Thank you for having me. Thank
I'll
you.
keep on saying Dr. Obey for some reason.
That's okay. That's all right. You know, obey is fine.
Okay.
All right.
But today we're going to really talk about some three key diseases, and Dr. Bay is going to shed some light in layman terms
Yes.
to help us understand high blood pressure, diabetes, and heart disease.
Yes. Yes.
One of the key things that I doing some research for this show, Dr. Bay, that I came across some facts about the various diseases. First, I heard that hypertension, which is also known as high blood pressure, is called a silent killer.
Yes.
And it's because so often we're walking around, there's no warning signs or anything. And, you know, needless to say what happens after. Also learned that about 1/3 of all people with diabetes do not know that they have the disease.
True. Mm-hmm.
That's scary.
Yes.
And heart disease is the leading cause of death in the United States. Over 600,000 Americans die of heart disease each year. Mm-hmm. So the topics that we're going to be talking about today are really serious, especially when so many of us are walking around like time bombs, sorry to say, without even realizing that we're ill, you know? So, what type of doctor are you? Let's talk a little bit about your background a little bit.
Well, I'm a pulmonary critical care doctor.
Okay.
That sort of has, well, not sort of, I have a interest in nutrition.
Okay.
Basically, pulmonary is the study of the lungs, and critical care is that ICU patient. You know, the sickest people in the hospital, those are the people I take care of.
Okay.
And the nutrition aspect comes in when I was training, my critical care training. At that time, there was no one actually feeding the patient. And when I grew up, in my house, you had to eat. If you didn't eat, my father used to say, if you don't eat, you don't stay here. So it was just confusing to me that the sickest patients we were not feeding.
Wow.
You know, so I did an extended fellowship at the University of Pennsylvania with well-known physician, Dr. James Mullen, in nutrition. Came back and at Beth Israel Medical Center, eventually became the director of nutritional support there.
Wow. That's a good background. So you know what you're talking about there. So share with us a little bit about these three diseases. Explain what they are first. I think if we could start there.
Yeah,
Hypertension.
Yeah, high blood pressure. Yeah, basically hypertension. And a lot of people call it just blood pressure. Do you have blood pressure? Well, basically what we're seeing now is that normal blood pressure is 120/80. Let's think of it this way with high blood pressure. The heart and the left ventricle is that chamber that pushes blood into the body, all right, into our arteries. Once that blood is pushed into the arteries, the pressure is generated. That top number is the number that we record when it's maximal at the push. As far as the blood going into the body, that's the top number. That's 120. That's our systolic. The diastolic is the lower number. That chamber, which is the left ventricle, when it's filling, the pressure in the blood actually decreases that pressure. That's the lower number. That's the diastolic. That's the 80. So it's 120/80. That's normal. Now, high blood pressure is once you get, and there's a range. You know, let's start. We don't walk around with a 120/80 all day.
Say that right.
No. We get upset. We yell at the kids. You know, that kind of stuff. And all of a sudden, my blood pressure is up to the moon, and that happens. We all fluctuate. But then we can get to an area of constant. If you're over 140. With the top number and over 90 with the lower number on a continuous basis, then that's high blood pressure. And it's very disturbing because it's a chronic disease and there's so many effects on the body over time if you have blood pressure at that level.
Okay. Is it the reason why it's hard to detect is because again we have our emotions and all these things that keep it fluctuating? Is that could be a reason? This is a layman person asking.
Hard to detect. Well, the thing of it is that there aren't many warning signs, and that is true. I think the reason it's hard to detect is because a lot of times we're not aware of what's happening.
Right.
You know, our bodies, I mean, we're doing so much. We're touching, we're feeling, we're walking, we're communicating. So we really don't take time to actually notice, you know, I just don't feel right, or I'm not concentrating. Maybe I'm hungry or whatever. There are those signs, though, that we can look for, meaning that you can have headaches, and that's an important one.
On a regular basis.
Well, yeah, you come and go, or every day I wake up with a headache, or boy, this headache wouldn't go away, or that's one of the key signs. Actually, just to diverse just for a second, I had a patient in the office just Monday. And she was talking about her husband. She's a elderly lady, and she said her husband died at 38, at the age of 38. And I said, wow, that's kind of young. She's like, yeah, he had high blood pressure, but we didn't know it.
Wow.
And he went to work that day and that morning, and you know, he's a truck driver, and luckily he didn't drive the truck that morning, but and the boss called her, and he had a massive cerebral hemorrhage because of his blood pressure.
Wow.
Yeah. So that is one of the things that we worry about. We worry about the fact that it is the type of thing, like we get headaches all the time. And who would think that I'm going to have a stroke or a cerebral hemorrhage or bleeding in the brain, a cerebral hemorrhage from my blood pressure? But it does happen. It really does.
You brought up just an interesting point a while ago. You talked about age. He was 38. Is high blood pressure something that young people shouldn't worry about, but only us more mature folks should be worrying about?
All right. Look at it this way. Young people, the likelihood that they're going to have blood pressure that is, should I say, malignant. We say malignant in the medical field, but a really high blood pressure that you're going to have secondary effects from, it can happen, but it's not the most common thing.
Okay.
Alrighty. Usually, we're talking about people that are 40, 50, 60 years old.
Okay.
That most of the time, those are the patients that we will find that have high blood pressure.
Okay.
Once you're over 60 years old, it's significant. Matter of fact, like you will find a large portion of the population has high blood pressure, and these patients, you know, they should be going to their doctor. They should be evaluated. They should be on their medications, and they should stay on their medications. It's not the type of medication I could take today and I may skip it tomorrow. It's something that you really should be regimented about. Yes.
That's good to know. And correct me if I'm wrong. This is not something I read recently, but I think I read it somewhere. So just I know you'll correct me. That as people of color have a higher percentage probability of having high blood pressure. Am I correct?
That is so true. So true. Hypertension, diabetes, heart disease, people of color, boy, it's almost like we have a ticket for it. You know what I mean? Like we have a special number to get these diseases. It is, and I think there are many reasons. It's cultural. I think it's what we eat. I think it's sometimes lack of exercise. It's the stress of the day. There's so many reasons that you have these particular diseases. But high blood pressure is one that we definitely have a lot.
Well, let's move on a little bit to our next culprit,
Diabetes, boy. Diabetes, and all of these are chronic diseases now. It's not like you have hypertension, you have diabetes, I'm going to give you a pill and it goes away.
Right.
No. These are chronic disease. Once diagnosed, you have to take care of it as, lifelong. So let's look at diabetes. Diabetes is our body's ability to handle sugar.
Okay.
Or glucose, as we say. Now, when there are certain, put it this way, diabetes can be broken up into two forms. It can be type 1 diabetes or type 2. Type 1 is usually called juvenile diabetes because that's the one that you get or you can find in children or young adults.
Okay.
All right. Usually there's a decreased amount of insulin secreted by the body. So you actually need insulin replaced. Okay. Type 2 diabetes is adult onset diabetes. Usually as an adult it'll come. And that is the type of diabetes that it's called resistant. For some reason the insulin is being secreted, but it's resistant. The cells aren't using it appropriately. So you have to help it out. So there are medications that you can take that may help it out, and you probably won't need insulin. Now, also with diabetes, you can have other causes, such like medications can cause diabetes. Steroid-induced diabetes. Many of us are on steroids for many different reasons. It's an anti-inflammatory, so we use it for many different diseases. But one of the side effects can be diabetes, and you can't properly metabolize the sugar, and the sugar at the cellular level is not used appropriately. Now, as far as the number that's appropriate,
that's where,
number that's appropriate of blood sugar that we should know. It's called a fasting blood sugar. And that's usually done in the morning before you eat. And you take that blood sugar. That blood sugar should be somewhere between 70 and 100 as normal.
70 and 100.
Yeah, somewhere between 70 and 100. Now, above 100, going from 100 to 130, there's a category in there called pre-diabetes, and that's sort of a new term over the last 10 or 15 years, pre-diabetics. Well, that patient, we're not classifying them as diabetics, but they have the potential.
Right. They need to start taking care of themselves,
right,
really.
Right. There should be preventive action should come about at that time, you know, and then once over 130, then we're classifying you as a diabetic, and most likely the doctor will prescribe something at that point.
You know, my ex-husband is a diabetic, and I know a lot of people who are diabetics, and I think it's so challenging in terms of, because of sugar. I mean, some of us are sugar addicts, included. So, you know, you love the sweets. And it seems that when you're a diabetic, and correct me if I'm wrong, it seems that amplifies that you just crave this sugar.
Yeah. Sugar, carbohydrates, it just seems as though the brain just needs it to a certain degree. And it's very easy to overdo those particular. And the problem is the one thing that we're craving, that's what the body is having the most trouble, you know, metabolizing and dealing with. The other thing that's important about this is that the secondary problems of hypertension and diabetes can be dramatic, really dramatic. I mean, we're talking about things like a renal disease or kidney disease, and to the point where you actually have dialysis. You know, you actually lose the function of your kidneys. Talking about eyesight with diabetic retinopathy. I mean, there are so many peripheral vascular disease, meaning that the blood vessels can't get blood to the extremities, and that's where you get the ulcerations of the toes. You lose the feeling, neuropathy in your toes and your fingers. There are so many side effects or effects that diabetes cause, that it's the type of disease that you really have to stay on top of. You really have to stay on top of it.
And last but definitely not least, heart disease.
Heart disease. Well, heart disease, you know, the lung and the heart work together. We used to say, you know, the only reason the heart exists is because it pumps blood to the lung. You know, but the heart is a very it's an interesting organ. That's the way I look at it. Do you know the heart is the only muscle in the body that never stops working?
Oh, really?
If it stops working,
that is funny.
It never stops.
Exactly.
If it stops, you're in trouble.
Exactly.
So it's a unique organ. It really is. And heart disease is something that we have to really think about, because there are secondary diseases like, for instance, diabetes and hypertension. Of course, they cause heart disease. All right. There are certain things that the heart just cannot tolerate. Obviously, the glucose, the vessels are affected just like any other vessels. And with hypertension, that pressure trying to push that pressure out, it affects the ventricle. It really damages the heart over time. The most important thing, two things. Number one is that we look at the heart, it has its own separate vascular system that supplies blood and oxygen so the muscle can work appropriately.
Right.
All right. Those vessels can get clogged.
Okay.
And that's the problem. And if the heart muscle is not being fed oxygen appropriately, then there's something occurs called ischemia.
Okay.
And ischemia is a decreased oxygen to a portion of the heart muscle.
Okay.
Dramatic ischemia causes myocardial infarctions or heart attacks. And that a heart attack is an area of the body, or excuse me, an area of the heart that actually, to a certain degree, it doesn't quite die, but it almost dies. I mean, it really is bruised to the point that it doesn't function appropriately. There are other aspects. It's called cardiomyopathy. Cardiomyopathy is an enlarged heart. And that can happen for many reasons, meaning that, for instance, with high blood pressure, if that left ventricle is pushing against an extremely large pressure to push the blood out, over time it gets larger.
Okay.
And the heart gets larger. Well, you would think that a large heart would be a stronger heart. No, it's just the opposite.
Wow.
An enlarged heart is a weaker heart, believe it or not. So cardiomyopathy, then it comes to the point where that left ventricle is having a hard time pushing the blood out now because it's always pushing against a resistance. So now you have a problem there. So cardiomyopathy, or a coronary, we call it coronary artery disease, where the arteries are a little clogged by those little cholesterol droplets. And those are the two primary ones that I'll talk about that most people hear about. But there are valvular heart disease, valvular problems and things like that that can cause dysfunction as far as the heart is concerned as well.
Wow. Wow.
Yeah.
So as a people, just people in general, and having these three, what are some of the key things that we need to do to actually, you talked about earlier in terms of the high blood pressure, some of the things that we could signs. So in terms of, let's talk about the heart disease, or what are some of the signs that something may be off?
Okay. If you're activity,
Okay.
if you're doing something, and say walking up the stairs, and all of a sudden now you're becoming short of breath. Like I used to be able to do three flights with no problem. Now I'm only doing one flight. Or if there is a little pressure here in my chest when I do that flight of stairs, or my arm gets a little tingly, my left arms, or I got a little tingling in my jaw. That's another one. Understand, and I should go back to diabetes. Diabetes that's one of those diseases that you may not get the symptoms of heart disease, like the pain and the tingling with diabetes. And you have to be careful with that because the diabetics, they don't have the nerves aren't as reactive. So they may not get the feeling of the chest pain or the tingling. That's one thing I just wanted to go back to. Other things would be just if you just outright had chest pain. You really should, with any activity or at rest, you really should see your doctor. Blurred vision, nauseousness or vomiting, epigastric pain, meaning that in the center of your stomach here, those type of, or if you have a cough and it's like a little frothy phlegm coming up, sometimes that could be the heart with something called congestive heart failure. There are many things that number one can cause it, and many symptoms that you can get secondary to it.
Right. We didn't talk about the diabetes too. What are some of the, although we said that many people walk around having diabetes and not even knowing it.
Right.
But is there anything that we should, any subtle changes that we should be mindful of?
Yeah. With diabetics, number one is that, and you talked about that craving for sugar and carbohydrates. Number one. Number two, it could be weight gain or weight loss. A lot of times most of the time it's weight gain. Though. Urinating frequently. That's one. And Just the fact that you have a thirst, you're always thirsty, and you always want to drink water. Those are usually the ones that we think of if somebody comes to the office and said, "Boy, I'm always going to the bathroom." If it's a male, the first thing I think of is prostate, but the second thing is you may have some diabetes going on, something like that, or always thirsty, some blurred vision. There are just so many things that you can think about, but those are the main ones.
So let's talk about, all right, so we could be walking around. How often should we go to our doctor to just even get a general checkup?
I think once you're my age, I'm
More
not
mature people.
I'm not going to say your age. You should at least go once a year.
Okay.
You should get checked once a year because, there are certain things that we can't do anything about because we are who our parents were. So the first thing I would say is, understand your family history. We are really truly what our parents are. So if mom and dad had diabetes, then even if you don't have it at this particular point, at some point in your life, there's a good chance you will develop diabetes. The other thing is that going to the doctor, definitely, at least once a year to get a basic checkup, even if you're feeling great, because you just never know. Especially, and another thing, smoking cigarettes. Yes, if you're a smoker, please get a chest x-ray on a yearly basis, at least a chest x-ray on a yearly basis. My recommendation would be to stop smoking. Keep your weight down. Boy, weight is a big issue. We are what we eat, and being overweight or obese is directly associated with so many diseases.
What's the difference?
What's the difference?
Yeah.
Okay. Let's look at body mass index. And that's the new phrase now. Everybody's looking at body mass index. Normal body mass index is 18 to 25. And you're in a normal weight. That is for your height, weight, sex, and age at that particular point. And you can go into any of the weight loss or weight programs on the internet and put that information in, and they'll give you your body mass index. Anything that is about 30 or 30 or above, that would be obese. Anything in between that, all right, 25 to 30, that would be overweight.
Okay.
So
what is it measuring though?
It's actually measuring your weight for your height.
Okay.
All right. See, because our bodies are built to, how should I say this? I want to put it in a way you'll understand. Our bodies are built to carry a certain amount of weight.
Okay.
All right. If you're 5'2",
that's me.
all right. No. That was a guess.
Okay.
That was a guess. If you're 5'2", all righty, and so for instance, there's a easy way, or the way that we do it. For every 5 foot for a female, it's 105 pounds.
Oh, okay.
Okay. For every inch after that, it's 5 pounds added onto it.
Oh, really?
Alrighty. Yeah. So that would be 105. So that would be 115 pounds. Now, it all depends on. I put a little race in there too because for African Americans, they may carry a little bit more muscle. So I say, muscle's heavier than fat. So I may give them about 5 or 10 more pounds onto that. So 120 pounds or whatever. But the thing of it is that kind of gives you a range for your height, how much you should carry. Now, if you're carrying 200 pounds at 5 foot or 250 at 5'2", then basically what you're saying is that you're having your body work twice as hard for all of those years. So if we really look at our health and weight and things like, then basically what you're saying is you're going against the natural functions of the body for all of that time. I look at it in the ICU all the time. I see it. Patients come in, they're either overweight or obese, and they have these secondary problems. And their secondary problems because of the overweight is worse than someone who's thin. Oh. So someone who's thin, they may have diabetes, but it may be a mild, and someone who's overweight, their diabetes may send them to the emergency room, and they may be in the ICU. So it's a different level. So I liken it to this. If you buy a new car, and you drive it at 100 miles an hour, from the day that you bought it until the day that you sell it, I would not want to buy that car.
You're right.
If you have your body, and it's a body frame that carries 120 pounds, and you have it, well, you have 300 pounds or 200 pounds or whatever it is for the rest of so many years, 10, 20, 30 years, then you're going to have secondary problems because of the weight. And the problems are dramatic. As we get older, the problems even become more significant. And you see that in the hospital all the time.
But I've never heard it being explained that way, and it really, really, it really brings light to it.
Okay. Yeah, that's why I talk to my patients. I'm like, do you know? No, I don't do that. I don't chastise them. We talk as though we're friends. You know, most of my patients are like good friends. We just sit and talk, you know.
But that's the best way, because as I was telling you earlier that I had the unfortunate situation to be in the hospital visiting a family member, and the doctor came in and was speaking to my sister and I about we had permission, of course, to about her situation. Right. And after the doctor left, I'm like, what did he say? Right. And I'm honest, I kind of think I'm kind of intelligent, but still the language at times. So what you were saying about you talk to your patients in that, you know, like a friend, in that layman terms. I mean, that's so important, because so many people are intimidated by their doctors. The doctor knows best, and not really asking questions to get not only better understanding of their situation, but also taking ownership and maybe even questioning some of the things that maybe, because I think also that sometimes when you go to the doctor, you're giving him X amount of information, and he's making that decision based on that information. True. So it's so important for you to have that dialogue.
That communication. Yeah. You know, the most important thing for a physician is history. Most of the time, the diagnosis that I make is from the history itself. Just listening to the patient, listening to the symptoms, listening to the time period, the severity of the symptoms, what they took for it, what worked, what didn't work. And then I say, okay, I think I know what's going on. But from there, the physician should explain his thoughts to the patient. I think we as people, including myself as a patient, we as people should be better healthcare consumers. All right. Number one, we should choose a doctor that, you know, sort of that we can get along with, just like anything. You know what I mean? That understand us as a person, will take time with us, will explain it in a way that I can understand it. That's very, very important. I feel that if a patient understands their medications, understands have some understanding of the disease that they have and what they should do about it, what they shouldn't do, how things, then it's a better chance that they will maintain a better control of that disease. If it's someone that doesn't understand why they're taking the medication, what the name of the medications is, what the side effects to look for, you know, the likelihood that they're going to be compliant decreases dramatically. Right. So we should be better healthcare consumers, truly.
That's so true. And okay, so especially now in terms of insurance, sometimes, you know, I think the time crunch is there that, you know, we have to see X amount of people, or, you know, so the time frame is not there in terms sometimes to ask the questions that we really need to ask, because again, the bottom line is our own health, right?
Yes. True. It's all about longevity, but the most important thing is to be healthy as long as you live. You know, I don't want to be, you know, 60 years old and then, you know, I'm going to live to 80, but from 60 to 80, I was in a nursing home.
Right. The quality of life isn't there.
I want to be healthy till 80. And I want to be, you know, get up in the morning, have my coffee, be able to run around with my grandkids. That's what I want. I don't want to be, you know, you understand what I'm saying.
Yeah, definitely. But that's powerful. I really appreciate you having you here today. I mean, this was very enlightening. Believe me, it was very enlightening.
Thank you very much. It was so nice coming. Oh, goodness. I'm glad you invited me.
Yeah, yes. I really appreciate this. And, you know, our viewers, hopefully you have learned a lot today, a lot of information that can actually help you to extend your life and have a better quality of life, you know, as we mature. And until next time, think positively. Thank you.